Hello again and welcome to Module 6. In this module, we will talk about medical communication and more specifically about patient interview. Patient interview is a way of getting necessary information from your patient. It can take place in different contexts, like before starting a treatment, for example. So today we will talk about some key components of a patient interview and also the vocabulary relevant to each component. Let's start with the basic steps of the interview. Of course, you will start with the greetings and building rapport with your patients. And next, you will need to take information about your patient's personal history. We'll talk about that later. Then you will move to the chief complaint or presenting complaint. You will also need the history of the present illness. You will need to ask about the patient's past medical history, their family history, their drug and medication history, and their lifestyle or social history. And then, of course, you will have to close the interview. We will see all of these step by step. So, the greeting and building rapport. First, you have the introduction. You will need to introduce yourself. We'll talk about the language for that later. And then you identify yourself and the patient and state the purpose of your interview. We'll talk about all this later. Then you will need to gather information about your patient's personal history, which includes information about age, occupation, sex, height and weight, family status, and children. Once you're done with, then you will move to the chief complaint, which is the reason the patient is seeking care and any other problems they might have. Then, after the chief complaint, you will move to what is called the history of present illness, which includes information about the location and radiation of the complaint, the severity and intensity of the complaint, the timing or onset of the complaint, previous similar complaints, the triggers of the symptoms, meaning what start the symptoms. You will also need to ask about any exacerbating or relieving factor, meaning what makes it worse or what makes it better. You will also want to ask about any associated symptoms. And you will give the patient some time to explain the complaint in their own words in case they have anything else they want you to know about the complaint.